So let's just get right down to brass tacks and talk about the study. So give our audience, which are pet parents, so kind of the Reader's Digest version of what were the objectives of the study, what do we want to accomplish with
Sure.
the study?
We've undertaken a study of a medicine called vemurafenib, and we're giving it to dogs that have urinary bladder cancer. Our group has focused our research efforts on bladder cancer for many, many years. And on one hand, we're excited because we're making tremendous progress. We've taken this disease from being one of little hope to one where we're getting usually over a year of good quality life in most patients. But we're not yet curing it, and we're not controlling it for as long as we really want to in a lot of dogs. And so vemurafenib offers the opportunity to buy more time to treat the disease more effectively. But it goes way beyond that, because vemurafenib is also being used in people with a variety of cancer types. And in people, this drug has dramatic beneficial effects in about half of the patients, but in about half of the patients it doesn't. And yet these are patients that look the same to the doctor and to the pathologist. So we have the opportunity to understand when we treat dogs, when the drug works, why does it work? But more importantly, if it doesn't work, why doesn't it work? Because if we understand why it doesn't work, we can then develop combinations to make the treatment more effective. So the reason that it's important on the human side is we have the opportunity to study tissues from the bladder cancer before treatment, during treatment, and then at the end of treatment. And we can do molecular analyses to know how to make this drug work better.
Well, the Puppy Up Foundation has funded another TC study, and we know just how catastrophic of a type of cancer it is. So it sounds like the work you're doing here at Purdue is really, really quite important. You've enrolled 34 patients thus far, so how are they doing? How's everything going?
The study's actually going really well. We're meeting all the objectives, or we're just very pleased with it.
The patients?
Yeah.
Good.
We've figured out the optimal dose of the medicine. When we give the optimal dose, it's generally well tolerated. Sometimes we have to tweak the dose a little bit if there's any drop in the appetite or anything, but in general, the drug's been well tolerated. We're seeing really good anti-tumor effects, and we expected that going into it, but it's always nice when you actually see what you expect. We've been seeing some nice remissions in somewhere around 40% of the dogs.
Wonderful.
And for a disease like this that can be so resistant to treatments, that's actually a very good number of remissions. We're definitely finding a medicine that's prolonging life. There's absolutely no doubt about that.
I love that, and having met Blue and Mackie, boy, Blue, I filmed him at a dog park, and he was running around having a great time. Mackie was doing great, and so you've given them just an exceptional quality of life. And from our standpoint of the foundation, when we meet pet parents all around the country, they always invariably ask, why should we do chemo? Why should we do radiation? Follow-on treatment of any type? And after all the wonderful companions I've met on my travels, what I tell them is that, if you can get an additional 10 or 12 months of good quality of life, that could be 10% more life. So what you've done in your clinical trial is phenomenal, it sounds like.
Well, thank you. We appreciate that, and we're convinced that that's what we're accomplishing. We're treating this like a chronic disease. We're buying the dogs life that they can enjoy and their families can enjoy. And at the same time, we're learning critical information that's going to change the outlook for this disease in the future. I would like to thank the Puppy Up Foundation for supporting the work we're doing at Purdue University in dogs with bladder cancer. Thank you.